a new and deadly threat in the war on drug overdoses.
These synthetic opioids can be up to 10 times stronger than the deadly drug fentanyl.
They may be added to street drugs without a user not even knowing.
They're stronger than fentanyl and hundreds of times more potent than heroin. Nitazenes are a synthetic opioid and they've just landed on Australia's illicit drug scene.
The fact that they're so potent means that a really small amount is able to cause an overdose in someone.
Public drug alerts have been issued in almost every Australian state and the ACT after overdoses linked to nitazene, including drug-induced deaths.
So we know that there's at least 16 or 18 deaths in Victoria that have been referred to in coronial reports, but that's actually the only formal information we have available at the moment around Australia around deaths.
Experts believe synthetic opioids like nitazenes are helping to fill the gap caused by a significant reduction in the global supply of heroin.
Where do we go to compare? We look at places like the UK and Europe, and they, like us, have not had a fentanyl crisis, but they are now potentially having a nitazene crisis.
Every sample that gets submitted gets sent off to the state testing lab.
At a drug testing clinic in inner Sydney, people coming in to get their drugs checked are being warned about the dangers of nitazenes.
So to look for those adulterants, those new or highly toxic drugs like you might have heard about nitazenes that are floating around.
What's got authorities really worried is that nitazenes are being detected in a range of illegal drugs they weren't expecting, such as counterfeit pharmaceutical products, including benzodiazepines. This means in some cases people are unknowingly consuming nitazenes.
This can affect anybody who is taking a substance from MDMA or snorting cocaine through to people injecting substances like heroin. This is why I guess we're so frightened.
Late last month, the synthetic opioid was found in counterfeit pharmaceutical products in Queensland. But drug experts say without a fully functioning early warning system, it is difficult to gauge just how widespread this problem really is.
So we could be seeing some nitazenes out there in the community in Queensland, which we're not actually putting all those pieces together in a surveillance kind of way to detect that.
That's where the state and federal governments need to step up, according to drug experts. They want better access to drug checking services and wider use of naloxone, a medication that rapidly reverses the effects of opioids.
These days we have it so it's a nasal spray. So it's as simple as anything else that you would have in your first aid kit.
But experts say the greatest tool is education, so people know the risks.
If it's something they're not using often, then this is going to affect them dramatically and cause them to end up in hospital here with us or even worse.
To give authorities the edge before Australia has its own nitazene crisis. Liz Gwynn, ABC News.